All right, let's bring in some more perspective. Dr. Om Srivastava, Infectious Disease Specialist, is joining us here on the broadcast. Thank you very much, Dr. Srivastava, for joining us and for standing by patiently during the Prime Minister's address. But the issue right now, the situation that we are seeing, an uptick in COVID cases, especially in places like Delhi, even Maharashtra, and many states now bringing back the mask mandate. Prime Minister has also alerted that we need to ensure that our guard remains up. How worried are you about the situation?
So thank you for having me on your show, Avni. I must say I'm about one stage before getting worried. I would like to describe the stage as being a little concerned and being alert. The stage for worry is not yet upon us, but it can very easily get into a stage like that. However, that I think if it comes to that, that will be only in the time of maybe June or July or August, not before that. Numbers climbing in themselves, yes, it is a concern for sure, but numbers alone are not translating into patients getting hospitalized or being admitted to intensive cares or being on ventilator. Fortunately, that aspect of clinical burden has not yet arrived, and hopefully it will stay that way and stay under control. However, in other parts of the world, there appears to be some more burden. The total positivity rate, the R0, once it climbs above the 5-figure mark, then it is something that you ought to be getting a little bit worried about. However, like I was saying, it's not yet upon us.
Right. Dr. Srivastava, the other question, of course, is with respect to the masks mandate. We saw, obviously, for a brief period of time, most states had made it, no longer compulsory. But that's now changing. One after the other, states are bringing back masks and making it compulsory. Is that something that would be ideal or would be suggested by experts such as yourself?
So again, there are two things here. One is that given the nature of the virus now in these variants, whether it's the XE or the BA1.1 or 1.452, all of these have demonstrated that they are hugely infectious. So not to wear a mask would be a big mistake. I think that wearing a mask is probably going to be not just preventing the disease from being transmitted from one to the other person, but also maybe life-saving. We don't know. At this time, we don't know. We are assuming the virus in its current form does not appear to be life-threatening, but the way it is mutating, that potential is always there in the virus. It can very easily become into a state where it will have multiple complications. So wearing a mask, making it mandatory, I would think is a very, very important step. And it's a logical conclusion to where we are, more out of the safety of the general population as a public health measure. Having said that, let me tell you, in my own interactions with patients or people coming to hospital for other infections, I don't think there's a lot of readiness to wear a mask at this stage. I don't think that right now, we can say that, look, we will tell the common population to wear a mask and everybody is going to listen. My feeling is that that stage will arrive only if there is an apparent fear of complications. Only then it will be something that we will see more and more. But right now, I don't see that happening because of a very simple reason. There is the mask fatigue in people. Yes. After a year and a half or 2 years, they're simply fed up. And look, whether we agree or not, it is understandable.
Yes, absolutely. There's no question of that fatigue which has set in when it comes to any kind of restrictions as far as COVID is concerned. But do you then think that, maybe the mask mandate, making it optional was done maybe a little too early, and we perhaps should have waited because we had just, managed to get people to start wearing masks and seeing that sort of become a routine and a way of life. And then sort of now once again trying to do it is going to be that much more difficult.
I agree with you. I think getting to do it now is going to be a challenge. It's going to be a task for everybody. Even if you were to say leave it to the choice of the individual, that is going to be even more difficult. But unfortunately, now that we are here, we'll have to find out what is the best strategy that can be employed.
Yes.
For further prevention of the infection. But yeah, maybe look, all of what you're saying probably comes in the realm of retrospective wisdom. We are all wiser in that category.
Yes, yes, absolutely. The other question, Dr. Srivastava, is with regard to vaccination drive. And of course, we've just seen 3 vaccines for children getting the emergency use approval of the drugs regulator. In terms of the way the response has been for the existing category that is above the age of 12 and teenagers that we're seeing, how do you see the response for the younger lot of children? Because we did see apprehensions, some form of vaccine hesitancy as far as parents are concerned already. Do you think that could sort of increase further as we get into the younger lot?
I think yes. In fact, it's already there. I don't think we are hearing more about it. I can tell you only from my own personal experience, because I'm talking to more than one school where I'm talking to mothers and of course parents, where they have got their own reservations about giving the vaccine to their kids anywhere from 6 to 15 years of age. And yes, there is a hesitancy, there are apprehensions, because once you've gotten your understanding and training from Google, then everything becomes ready-made kind of knowledge. So that's that information, the WhatsApp information, I think that's actually harming the total merits of the vaccine program in our country. But it's there. We'll have to deal with it. We'll have to try and correct it. I don't see how it can be enforced, but I can say this much, that you will need to talk about it again and again, repeatedly in these platforms, and get parents to see your point of view, or at least the scientific part, and then decide from there. So there is hesitancy, but I don't think that's going to be like a terminal stumbling block where we can't overcome it. We can, but it's going to take a little bit of time, I think.
All right, Dr. Srivastava, thank you so much for joining us with your perspective.
Thank you.